Hello, everyone. I'm Sharika Davis, and this is Miss Florence Rogers. Today, we'll be doing an interpersonal interview. Miss Florence is a physical therapy technician among the healthcare sector. So, Miss Florence, before we begin, do you give me permission, consent, to record this video?
Yes.
Okay, Miss Florence has given consent, so I'll proceed. Tell me why you chose the profession of a physical therapy technician.
I chose to become a physical therapy technician because I've always been passionate about helping people regain
Mm-hmm.
regain independence mobility,
Okay.
watching patient progress
Mm-hmm.
from limit movement
Mm-hmm.
to walking again
Okay.
is incredibly rewarding. I enjoy hands-on
Mm-hmm.
part of their healing journey.
Okay, so if I heard you correctly, Miss Florence, I'm going to just kind of recap what you're telling me. You enjoy being a physical therapy tech because you're helping to transform your patients' lives by regaining their mobility. So, just a little bit about what a physical therapy technician does. Can you just summarize that in your own words? What a physical therapy technician does?
A physical therapy technician helps the physical therapist
Mm-hmm.
and occupational therapist to help the page to work with the patient
Okay.
to rebuild their strength.
To rebuild the strength. Okay, I think that is just so wonderful because there's so many different areas and divisions and intricate roles, to me, within the healthcare sector that a lot of people don't know about. And then when I learned that Miss Florence was actually a physical therapy technician, I was like, well, this is something very unique and different that I'd like to know more about. So tell me a little bit about your educational preparation. Was this like an on-the-job training, or did you go to like classroom training to get prepared, for your career?
I accomplished a physical therapy technician certification with independent class learning and clinical experience.
Okay.
I trained covering anatomy, patient safety, and therapeutic exercise, and
Okay.
how to assist licensed physical therapy in a clinical setting.
So you're working with alongside the actual physical therapist? Okay. Okay. Well, that sounds very, very good. So, regarding your primary role and then your responsibility when collaborating with nurses and other healthcare professionals, a little bit about what you do when you're assisting that physical therapist with like a treatment plan for your patient. Just tell me a little bit about that.
My role as a physical therapist is planning treatment plans, engaging patient safety during exercises, and reporting any changes in the patient's physical ability and
Okay.
respond to treatments. I also communicate with nurses
Mhm.
about the patient mobility needs, pain levels,
Mhm.
and any fall risk.
Okay, you seem a little bit nervous, Miss Florence. Just calm down. It's just a little bit of us just talking. So don't be nervous at all. So just a recap of what Miss Florence saying her responsibilities and roles are. She helps the physical therapist when he's implementing the treatment plans for the patient, all at the same time while ensuring patient safety, while helping with patient exercises, and also communicating with other people of the healthcare team as well in order to make sure that the patient's needs are met. Is that correct, Ms. Florence? Okay. So when working directly impacting patient care and outcomes, tell me a little bit about tell me a little bit about that. How helping patients with their exercises and mobility help contribute to improved strength and things to be improved for that patient overall.
By helping patients with therapeutic exercise and mobility training, it contributes to the faster recovery, improved strength,
Mhm.
and greater independence.
Okay.
My role supports early habilitation,
Okay.
which reduces completions like complications like blood clots,
Okay.
pressure injuries,
Mhm.
and leads to better overall outcomes.
Excellent, excellent, excellent. Okay, so when looking at anything that might be a key challenge when working with the interdisciplinary team, tell me about how you would overcome a challenge.
One key challenge is communication.
Okay.
Different team members may have different priorities
Okay.
or schedules.
Okay.
I overcome this by being positive,
Okay.
proactive in school, in team meetings
Uh-huh.
when possible,
Okay.
and keeping line
Okay.
of communication with nurses,
Okay.
therapists, and ensure we are all engaged on patients' goals.
Excellent, excellent. Okay, this is a very interesting field. So, in your experience, what makes for a strong, effective interdisciplinary team?
Respect,
Yes.
clear communication,
Uh-huh.
share goals, make a strong team.
Okay.
When every member understand their roles
Okay.
and value other communications,
Mm-hmm.
it leads to better communicating and patient care.
Okay, that's very true, and not just to me in the healthcare environment, but in every environment. So, when prioritizing and balancing your role with the roles of other team members to ensure comprehensive patient care, tell me, how would you do that?
I focus on time management
Oh,
flexibility.
yeah,
Communicate with nurses
yeah.
to schedule therapeutic sessions around medications, meals, and procedures.
Mm-hmm.
Respecting each team member roles
Okay.
helps us avoid overlap and delay in care.
Okay. So we're almost at the end of our interview, Miss Florence. I won't keep you much longer, but please share with me a case where you had an interdisciplinary collaboration significantly improve the patient's health or their quality of life.
We had a stroke patient who was unable to walk.
Okay.
Though close communication between nurses, occupational therapists, speech therapists,
Mhm.
and physical therapists,
Yes.
we created a hospital plan.
Okay.
The nurse managed the patient blood pressure
Mhm.
and pain, while therapists helped with mobility
Okay.
and communicate. After a few weeks, the patient was walking,
Mhm.
assist with health improvement, speech, and daily functions.
Okay. So how could a nurse collaborate more effectively with your discipline to make, the job maybe a little bit easier, more smoothly?
Nurse can support the work by re-engaging mobility goals,
Mhm.
doing daily care, and encouraging patient to participate in therapy. Communication is key.
Yes.
Just a quick update about patient communication
Mhm.
or modes can help us tolerate the sessions more effectively.
Okay. So when we look at describing some tools or technologies or processes you have utilized to improve communication and collaboration between the nurses and other professions, tell me a little bit about that. Maybe like the use of electronic health records.
We use electronic health records to direct delegate to the dem,
To
excuse me,
document?
to document
Yes.
therapy sessions
Okay.
and progress
Uh-huh.
with nurse and other team members can review.
Mm-hmm.
We also participate in disciplinary publics or roundings, which engage real-time updates
Okay.
and better communication.
All right. Okay. Okay. So then can you share with me maybe a time when you experienced conflict with another team member and how you might have resolved the conflict?
There was a disagreement with a nurse
Mm-hmm.
over when a patient should attend therapy.
Okay.
If conflict with this scheduled procedure,
Mm-hmm.
I approached the nurse.
Yeah.
We agree to reschedule a therapist
Mm-hmm.
to a better time.
Okay.
We learned the importance of checking with each other's schedule
Mhm.
ahead of time
Okay.
and improving our communication going forward.
Now, I think it's vital because communication is very key and effective, in any profession,
Right.
regardless as to what you do.
Right.
And I think that effective communication helps make the job easier and also the work environment that
Right.
you're in. So I think that's a really great way that you handle that type of conflict. And final question today would be describe how your education helped to prepare you for an interprofessional collaborative practice.
My education emphasized teamwork,
Yes.
communication skills, and patient-centered care.
Okay.
We learn about the role of other healthcare professionals and participate in mock scenarios
Okay.
to practice collaborating, which help me feel confident working with the team.
Right. I think that's wonderful to be able to use mock sessions or any type of simulated environment because it helps to give you practice, but in a real world scenario.
Right.
So I think by you being able to get that hands-on experience help to better prepare you for the occupation that you're currently in. Well, Ms. Florence, I'd like to take this time to thank you for allowing me to interview you just to kind of get a general idea. I know there's so many more things that you can tell me about the job and the role of a physical therapy technician. But at this time, we're going to go ahead and conclude the interview. Thank you so much. I wish you much in your endeavors. And again, I thank you for your time. So, ladies and gentlemen, we're now concluding the interpersonal interview between Sharika Davis and Ms. Florence Rogers, who's a physical therapy technician. Thank you so much for listening, and I hope you learned just as much as I did about the role of a physical therapy technician.